We're on our clinician dashboard. This is the landing page for all of our clinicians. From here, they'll have access to all of the patients that have been assigned to them. They have the option to filter or to create customized lists. So in the drop down here are some examples. So there can be a group list if it's a group of physicians or clinicians that work together, a coverage list if it's a clinician that's working on a specific department, so a cardiology department and they're covering for somebody else. They can have a coverage list, they can have an active inpatient list, etc. They can create as many lists as they want and they're fully customizable. So from here we can also see on the left-hand side, we have some buttons, so it'll give you the total number of patients that are currently assigned to this specific clinician. Underneath, we have some other buttons, so it'll tell us if we have any patients that have critical results or abnormal results or something that needs to be reviewed. And by clicking on these buttons, it'll take the clinician or whittle the list down to the patients that have something specific that needs to be dealt with. This is making it really easy. It's really quick for the clinician to make some decisions and to be able to view information that would be very pertinent to them at that time. We also have a search option. So by going into the little search box here, we can start typing a combination of letters from the patient's name and it'll bring the list down to patients that have that combination of letters. So for today, we're going to look at Michael Smith. So we can see that all of his data has been entered. So we can see his demographic information, we can see his NHS number, we can see that he has allergies, that the patient does have cautions on his file that he was confirmed positive for COVID-19 at some point in the recent past. We can see that he has problems in his problem list, so we can see, he's known for chest pain, that he has a CKD, depressive disorder, diabetes, and by clicking on the number 2 here, it'll bring us to the rest of the list, so fatigue, and he also is known for heart failure. We can see the most recent medications that were prescribed during the latest visit of the patient before the current one. And by going down here, we can see the most recent vital signs that were taken during triage. So we can see right away the ones that are critical are in red, bolded, underlined. They have an exclamation point. So those will draw your attention right away. So we know right away that there's critical results for the BP and the respiration, and there's an abnormal result for the pain scale. Any abnormal result will be bolded in black and underlined. So with this information, as a clinician, I'm now going to go and check in on the patient, and I'm going to go and schedule some tests for this patient. So now we're on the patient landing page. So this is the main page in the patient chart. So on this page, the clinician will have a clear view of a few different data points. So right here, we'll see we have an allergy list. So the allergies are nice and clearly defined. They're easy to see. At the bottom of the allergy list, we have a caution box. The caution box could be there for a number of different reasons. It could indicate that the patient is a fall risk, or that the patient also has a DNR, or the patient has some kind of a contagious virus or something like that and is in quarantine or has different things that need to be done before going into the patient room. So this is all configurable. We can have any number of cautions in here. On the other side of the screen, we have the active order list, so we can see any orders that were done for this patient, either since being admitted to the ED or from previous visits, if they see other specialists that are within the hospital or something like that. So the orders will all be visible here. And on the bottom, we have the interactive care grid. The interactive care grid is a wonderful tool. It gives really quick and easy access to data from past visits to the hospital for whatever reason. So here we can see that we have the patient vitals, and this patient is known to have renal issues, so we're also tracking and trending renal functions. But this can be completely configurable as well, so it can be changed to reflect anything that needs to be tracked and trended for a specific diagnosis for a patient. It can be hematology, coags, liver function tests, etc. And they can be opened and closed. So if I no longer want to see the vitals or the renal function tests, I can just click it out and it'll close up my ICG, or I can open them back up again. We can also see from the ICG that next to some of the data points, we have an arrow pointing to the left. Those, if we click it, will bring us back to past visits, so we can go back to past visits and see anything that was done for the patient during past visits. So any vital signs, any lab work, any notes or ancillary services that attended to this patient will be in the ICG. Right now, we're going to go and place some orders for this patient. So we're going to go to the left-hand side of the screen under shortcuts, and we're going to go to order entry. And we're going to click here, and we're going to go and prescribe some tests for our patient. So once we get to order entry, you can see that we have order options. These are completely configurable. There can be as many order sets pre-configured as you would like. There's also an option to add to the clinician's favorites. So if there's tests that the clinician uses often, they have the option to add it to the My Favorites tab. It's really quick and easy. They just need to click on it and click Add to Favorites, and it'll appear under their Favorites tab. So in this case, for this patient, we're going to click in the frequently ordered tests for the A&E. And for this patient, we're going to prescribe a U&E with glucose. We're going to also go with an FBC, a D-dimer, and a portable chest X-ray. And then from there, we just have to go and click Add Order on the bottom right. And now it's going to ask us a few questions if there's any clinical data that we want to enter as to why we're doing these specific tests. So this is a free text. It can also be a drop-down if need be, or it could be something that we can make not required. In this case, it is required to enter something, so we can just write lab tests so that we can proceed. So we're just going to click OK. And then it's going to ask us if we want to associate the test to a specific problem on the patient problem list. So we're going to associate it to the chest pain. And then click OK. And it'll give us the option to add it to another problem if we want to. So because this patient presented with chest pain and fatigue, we'll also add it to the fatigue. So we're just going to click. I'm currently clicking the options, but you can also just type the numbers in on the bottom. Now we're going to go OK. And OK again. And now it'll ask the same thing for the full blood count. So as I previously stated, these are mandatory for us in the demo, but it is not a mandatory field. It can also be a drop-down or a pick list. So basically, it's configurable. If you don't want to have to enter that data, you do not need to enter that data. And then we'll just add lab here. Now for the portable chest, it's going to ask if there's any clinical information. So we're just going to enter that the patient has CHF, so he's known for CHF. And then it's going to also ask us for the method of transport. So if the patient is going to be walking, if he's in a wheelchair, etc. So we'll just put that the patient's in a wheelchair, so 2. So once we've entered all of the tests that we want to order and we've put in all the required clinical information, it'll bring us back to our order summary. So we'll see on the top here that we have the test that we prescribed. So we're just going to click on order summary on the bottom. And then once here, if there were to be an issue, the system is intuitive enough to let me know either that there's a duplicate test, or if it was a medication and there could be a risk of an allergy, or something that shouldn't be taken. The system will let me know, and I will get a pop-up advisory. So on the right-hand side under advisory, I would get a little icon and I wouldn't be able to approve my list without having gone through all of the advisories and putting in either a reason that I accept it and I want to go forward, or it gives me the opportunity to go back and edit my order or to remove the order that's a duplicate order, etc. So it's intuitive enough and it stops me and it will not let me go forward if there's something that it doesn't seem or see as something that should be done. So we're going to go and accept this. And now that's gone. So once those are in, they will go into the work list of the assigned personnel. So the people that need to go and complete these tests will now have that in their order or their work queue. So it'll pop up in their work queue and they'll know that it's something that they have to go and do. So as you can see, we're back on our clinician dashboard. We're currently waiting for the test results for Mr. Smith to come back. If you look at the left-hand side of the screen under our 16 patients, you can see that now we have a 1 under critical. So those are the results for Michael Smith. So you can either click on the 1 and it'll isolate Michael Smith's name, or you can just go and click on our patient's name. Once here, it'll open the secondary window and we can see on the bottom that our results have come in. Right above the results, we have the same blocks that you would find along the left-hand side of the screen. These are patient specific, so it'll take you to the critical result or the abnormal result for our patient, or you can scroll through and review them all. So for him, we can see that his potassium is abnormal. Anything abnormal, like with the vital signs, will show up black and bold and underlined. And anything critical, like the glucose, will show up red, bolded, underlined with an exclamation point. So we can see that those are there. We can see that his hematocrit is also abnormal. And if we scroll down a little bit further, we'll see that his D-dimer is also abnormal. So having everything on the dashboard like this gives the clinician the opportunity to review everything quickly and make a decision with pertinent information without having to go through an entirety of a chart to find the information that is necessary. So once all of this has been reviewed, the clinician is going to take the decision to admit this patient to the CRCU. Okay, so the patient is now being transferred to the floor. So what's going to happen is we do have access to some whiteboards. So we do have a bed census whiteboard. If you click up here, it'll open that up. On the bed census whiteboard, it'll give you a list of all of the available beds, which ones are occupied, which ones are currently closed for maintenance, etc. So it's easy to manage which beds are open and where to place a patient. It can also track which patients are going to be discharged shortly for to be able to manage incoming and outgoing patients. So now that the patient is on the floor, we're currently logged in as our clinical nurse, and you can see that they have access to a similar dashboard to those of the clinicians. So from here, the nurse will also have access to patient lists, also all configurable. So these are patients that are assigned to her on the unit. So we're going to look down and see that our patient Michael Smith is now here. He's been assigned to a location, so he does have a bed. And we can go on to the right-hand side. We have all of the demographic information. We can view the allergies if we click this little thing here. And then if we go underneath, we can also see all of the visit medications, and they have access to the problem list. So the nurse does have all of access to all of the same information that the clinicians do. So on the bottom here, you'll see that the nurse also has access to a work list. These are all the tasks that have been assigned to her for this specific patient. She can also work off the work list that is within the patient chart. So that's what we're going to do now. We're going to go in and launch the visit. So once everything's been opened here, you'll be able to see that the nurse has access to all of the same information that the clinicians do. It is one shared chart for everybody who works in the establishment. So everybody has access to the same information as long as they have securities to be able to view it. So there's no doubling of information, there's no missed information, nothing falls through the cracks, so everybody gets the same information. So this was just to give you an idea of the nurse's view and what it looks like. So now that our patient has been admitted to the unit, we're going to go back in as a clinician so that we can go and see what has been done since the patient has been admitted to the unit. And we're going to go in and prescribe some medication for him. So we're already on our Michael Smith. We can see that we do have access to the blood work that was done. So we're just going to launch the visit. So once in the patient chart, we can see that we have access to everything that's already been done for this patient. Like I previously said, everybody who works in the institution will have access to patient information. It is one single patient chart. So as long as the securities are enabled for that professional to see the information, they will have access to it. So from here, we're going to go and see the treatment plan because this patient already had a visit from the nutritionist. So we're going to click on the treatment plan and I'm going to go and see what was entered. So this is one of our clinical documentation tools. Um, these are used to build any kind of assessments that will be used. It can also be used to build flow sheets or flow charts. So from here, I'm going to go and see, I can see that one goal has already been entered. So I'm just going to go and click right there and I can see, okay, what was entered. So it's a high serum glucose. The goal is to lose 1 stone and lower BMI and the serum glucose. The intervention is a low sodium diabetic diet, and it'll be reviewed every 3 months with the nutritionist. So I have access to this information. The nutritionist will have access to this information. Any other ancillary services working with this patient on their treatment plan will have access to it. It's a really multidisciplinary approach for a system, and it really facilitates a team working well together as they have access to all of the same information. Okay, so now what we're going to do is we're going to go and prescribe a new medication for this patient. So we're going to go to order entry. And I'm going to prescribe for him some metformin to help with his blood sugar levels. So I'm just going to search for metformin and it should pop up momentarily. Okay, so I'm going to select the one on top here, metformin. So we're going to click on this and we're going to decide what kind of dosing we want. So I'm going to do 1 tablet twice a day. And then I'm going to review. So now our patient's been with us for a few days. We can see that he is stabilized enough for him to be able to go home. So we're going to discharge our patient to outpatient care. So the first thing that we're going to do is we're going to click on our medications tab at the bottom and we're going to do a med reconciliation. So from here, I'm going to click on the little pencil next to the discharge meds, so that I can go and determine which medications I want to send home with my patient. So I'm going to go and click on the drop down here. I'm going to click the current visit medication so it gives me a list of everything that he's currently taking and I can decide which ones I want to continue and which ones I want to get rid of. So I'm going to only continue the digoxin. I'm just going to bring this one over. I'm going to bring over his epoetin for his chronic kidney disease. We'll also bring over the furosemide. So we'll just scroll down a little bit and we'll find his metformin, which is at the bottom of the list. And then we'll accept it. So we've discontinued everything else and we've continued with these meds for the patient to be sent home with. So now that that's done, we're going to go back into the patient chart and complete his discharge report and a consult request so that he can be seen in cardiology. So now that the med reconciliation is done, we're going to go in and we're going to request a consult in cardiology for our patient. So we're going to go to order entry. And from here, we're going to do a quick search for a consult with a cardiologist in the outpatient clinic. All of these consult requests and all of the order entry is all customizable. If it's something that is used often, we can have preset order sets done for you, as well as anything that is used often by the clinician can be added to their favorites. So we're going to click cardiology consult and we're going to add the order. So now we're going to go to expand and we're going to choose we're going to go by specialty and it'll come up with a list of specialties. We're going to go to 7 cardiology and then it gives us a list of available cardiologists. You can also and it's going to be a consult, so 5. And we want it to be soon, so we're going to pick 2. If we would pick urgent, it would be something more along the lines of an oncology consult, which is less than 2 weeks. So we're going to pick a soon, and it's going to be an advice consultation, so 1. And then we're going to click enter, and that's going to go off into the queue to be scheduled. So now we're going to complete our discharge summary for our patient. So we've clicked on discharge summary. We're going to go in and enter the principal diagnosis. So we'll just go up here. We'll choose a principal diagnosis. It's all pulled from data that's already in the system, so we don't have to add anything. It's all drop-down lists. And we're going to add an additional diagnosis. We'll go in and add the patient's diabetes. And then the chief complaint, we'll go in and put the chest pain and fatigue. So once that's done, we'll go in and enter a summary of care. This is a free text box. So it's just basically an update of everything that was done. So the patient was seen for chest pain and fatigue, suspected progression of heart failure, etc. So we can just fill this in, a nice little summary. Does the patient have a follow-up scheduled? Yes or no. He does have a follow-up that will be scheduled in cardiology, so we can leave it at yes. We can add an additional plan of care if necessary. There is already one there for nutrition, for dietetics, but we can go in and add another one. We can go in and put one in for the heart failure. And we can go in and put a goal in if there needs to be one. So we can add a goal in for the heart failure. So whatever it might be, an expected date of resolution. We can put in a date where we want things to be better. So if it's, getting his blood pressure under control, so we can, add in another date. And then we can add in the outcome and the interventions once that's done. So we can go and click continue. And then from here, we can put in the follow-up date if one has been scheduled and who the follow-up will be with. Right now, we don't know because he hasn't been scheduled yet. So we can just leave it as is and just accept it. So now that's done and the consult is done. So the consult, once it's done, it goes straight to the central scheduling queue. And from there, we'll be able to go in and verify the wait lists and verify the availabilities of the cardiologists. So we're going to go there next. So now we're in our central scheduling queue. From here, we're just going to click on the schedule icon on top and it'll bring us into our general scheduler. So this is what our general scheduling looks like. The scheduling queues also serve as wait lists. So from here, we'll be able to manage the amount of patients that are on the wait list, make sure that they're in the correct wait list, and manage the priority of their appointment. The scheduling queues are based off of the resources. So the resources can be one of three things, either a piece of equipment, a room, or a person. So a room for a specific test, a piece of equipment, MRI, radiology, something like that, or the person, the consultant that's actually going to be doing the appointment. So from this view, you can also see that we have these blued out titles on the top. So when there is a lot of people on the wait list, you can actually filter or use these to reverse. So you can see the oldest first or the newest first, depending on what you're looking for. So those are all possibilities. So what we're going to do now is go into the cardiology clinic master. And all of these are configurable. Your wait lists are configurable, your resources are configurable, and you can plan your schedules as far ahead as you have them available. And in our newer phases as well, the clinician will have the ability to manage their own calendar. So from here, we can see that we have 2 patients that are waiting to be scheduled in our cardiology master list. So we're going to pick Trenton. So if we click on this, it'll take us to our scheduler. Now, when we fall into our scheduler, we're in a month view. That's the default, but you also have the option to view it by week or by day. So that's a preference. It can be defaulted either way. Once you're in here as well, you'll be able to see that in my cardiology master, I have 3 cardiologists that are available to be scheduled. And we'll be able to tell which ones are available on which day based on the color that they've been assigned. So we can see that cardiologist Tim has a purplish color, cardiologist William has a pinkish color, etc. So we know which ones are available on which day. On the right-hand side, I can see which test has been ordered. So I can see that the consultant is Chuck cardiologist. The problem the patient is having is angina, and the reason for the test that is requested is because the patient's having chest pain. So what we're going to do now is we're going to go to next week in our calendar. So we can click here. It'll bring us to tomorrow, but if we click here, it'll bring us to the next available date, which is the 30th. You can also use the calendar in the bottom left-hand corner. If you know you want to go further in advance, you can actually just go and click on the day. So we can go and click on a day for next week, example, the 7th or the 5th, whichever. And all of the green slots are appointments that are available. So the slots can be configured based on the timing that we know that it takes to do the specific exam or the test. So they can be 15-minute slots, 30-minute slots, they can be 90-minute slots, and you can have multiple slot times in the same day based on the requirements. So once the patient has been scheduled in their selected appointment time, so we're going to do 11:30, we would click accept and it would be put into the schedule. So the clinics are run or use the Flex solution the same way that it would be used internally. So they have access to all of the same information. The clinicians would have access to a launch pad. It could be based off of a work queue if that's easier for them. They would have access to the schedule so they can manage their time during the day. And all of the information would be shared within the establishment. So the outpatient clinic and the inpatient clinic will all have the same amount of information or access to the same information.